Hello and good evening to all of you, and a very warm welcome in today's session. So, it's going to be a practice session today, okay? So, you will get a scenario, and I need two volunteers who will present the case. You will get 2 minutes preparation time, the reading time, and 10 minutes is going to be your performance time, okay? So, who would like to volunteer first? I need two names, please. Hello. No one's ready? You know the topic, right? This is all about bullying. Who would like to try?
Hello, ma'am.
Yes, hello. This voice is very, very familiar. This is
Okay, thank you, ma'am. Yeah.
this is
So I'd like,
Kazi.
yes, ma'am.
Always there, huh? Very good. Okay. So you're ready to present, huh?
Okay.
Yes, fine. Take it easy, okay? Take it easy. All right. So I will be showing the scenario and I will fix the timer as well. All right. Give me a moment. Mhm. Uh, You people must be familiar with the topic, very hot topic these days. And the scenario came in the exam as well. So can be repeated. And all right, Dr. Kazi, can you see the scenario? Hello?
Yes, yes, it's visible here.
Visible. Very good. Just one slide. Take you 2 minutes. Organize your thoughts. Okay, your time starts now. Start, please.
Hello.
Yes,
Am I
hello.
audible, ma'am?
Yes, very
Okay.
clear voice.
Start.
Start,
Yeah, yeah.
please.
Okay.
Okay.
Hello, I'm Kazid, ST5, and you?
Yes, I'm Alice Sampson and I'm the ST2 here.
Okay. So nice to meet you, Alice. How are you?
Yeah, I'm okay. I'm good. Thank you.
Okay. So I can see that you have recently joined in our department. So how is everything going in the department?
Yeah, everything is going on well.
Okay. So do you feel supported in our department?
Yes, kind of. Yes, I think I'm well supported.
Okay, that's really nice. If anytime you feel any problem, don't hesitate to discuss with us. Okay, me and my colleagues are really helpful. We will try our best to help you. Okay.
Yeah, that's good.
Okay.
That's so nice of you.
Okay. Thank you. So, Alice, what I understand that today you are here to discuss about the odds ratio. Am I right?
Yes.
So, Alice, why specifically this topic?
Yeah, because I find this topic very difficult. And also, my consultant has asked me to prepare the topic as soon as possible. And
Mhm.
I have to prepare a presentation as well. And he's going to ask me about this topic.
Okay, okay. So, as you know, that this is really very important topic to know about this topic, specifically the statistics, to do any audits and also research. And whenever we'll read the guidelines, also you will find some of the odds ratio type of things. So it is really important. Any idea prior about this?
Yes, I read about it, but I find this topic really very difficult.
Don't worry. Actually, statistics, like it is different from our usual practice, so it's supposed to be. Don't worry, we are here to help you. So I'll try to describe in a simplest way.
Yes.
Okay.
Yeah.
Any other concern apart from this?
Well, I just want to know about this topic, in one day, if it's possible, because I have to present it in front of my consultant.
Mhm. Okay, okay. So, okay, you want to learn everything in one day, right?
Yeah.
So if you feel like any other concern, don't hesitate to tell me, okay? Whatever you will discuss, it will remain strictly confidential because, statistic is something different topic, so it may take some time. Don't worry about that. It takes actually for all of us, it takes some time to understand, okay?
Yes.
Okay. So I can see that from the odds ratio, I'll tell you that what is odds ratio first and then like what is the implication. So odds ratio is the probability of outcome.
Hmm.
Okay, so probability of outcome in case of exposed and the non-exposed. So like I will give you any of the like what is your research topic? Can you tell me one topic what you are like trying to prepare?
Yes, yes. Like the rate of cesarean sections, like if 100 women are going for cesarean and 40 had cesarean, then I don't know how to calculate the odds ratio.
Okay, so what is your outcome actually? What you want to see? The
Yes.
recovery or anything?
Yes, yes, I want to see a recovery. Yeah.
Okay, okay. So for your example, I will use this. So as you can see here, this is the so our exposure is the cesarean section. Okay. So
Yes.
we'll write here the cesarean section is the exposure and another one is without cesarean section. So our
Yes.
outcome will be the recovery, right?
Yes.
So recovery will be it will be well recovery and another one will be like not well recovered. So this will be our two heading. So if the cesarean section it is the exposure and the outcome is the recovery. Okay. So here will be like four steps. So if we calculate it cesarean section outcome, the recovery is good. So it will be like A, not good it will be B. Without cesarean section, the good outcome it will be C, and the without like good recovery it will be D. So we have divided like four parts. Now how we will calculate? So in the export part, the recovery, so A by B, it will be our outcome. And in case of non-cesarean section, it will be C by D. So odds ratio will be just, we will like divide it. So A by B and subdivided by C by D. Am I clear so far?
Yeah, but I find it really difficult. I'm not able to concentrate.
Don't worry, it will come with time. So Alice, I can see that you are a little bit uncomfortable. So is there anything going on back up in your mind?
Mm.
I'll not share with anyone, okay? It will remain strictly confidential, and we are facing the same situation, like in the training, we have some ups and downs.
Um,
Is there anything you want me to share with me?
Yes. Okay. So if you are not going to disclose it to anyone?
No, 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 never, never. It will remain strictly confidential, and I will try to help you in every possible way.
Mm-hmm. Actually, the other day my consultant scolded me very badly because I was not able to explain the odds ratio, and he shouted at me. And it seems as if I'm getting overloaded with the work as well. And I don't feel like coming to hospital also. It's really so degrading for me.
It's really very difficult, and it must be very difficult for you. Don't worry, we are here to help you. Can I ask few questions to know more about this?
Yes,
Okay. So, do you feel that this type of behavior he is doing on with only you or like other colleagues also? Did you notice that?
I think it's me and there's one more colleague. But for me, it's going on for the last 6 months.
Oh my God, you are tolerating a lot. So this is actually considered bullying, and this type of behavior should not be tolerated in any way. Okay.
Mm-hmm.
So I'd like to reassure you that the help is available. Just another question that is this like he is doing in private or in like in front of the patient or the other colleagues?
Yes, yes, everywhere, in front of patient, in front of colleagues, in the ward, even in the outpatient departments, everywhere.
Very difficult, right? Yeah. And is it only the verbal or any other like emails or anything he is sending after
Yes,
anything?
yes. For the odds ratio, he has sent me an email and he has strictly uh, told me that I should be prepared with
Mhm.
this topic. Uh, so I'm really afraid now.
Yeah, don't worry. So do you feel that, like as you mentioned, that you don't want to come to the hospital also, so that is affecting
Mhm.
your, don't you think that it is affecting your like quality of life and your mental health as well as like patient safety also, right?
Yes, 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 it is. I want to know if there is any solution for this.
Yeah, yeah. Help is definitely available. So what you can do, I'll suggest you at first, like take the sick leave. So it sometimes help. Like if you are out of this situation, so sometimes it helps. And another thing, like you can discuss with your GP, or even like someone if you believe that who can help you. So it is called like ventilation. So you can discuss with them. So if it doesn't work, you can also discuss with the counselor.
Mhm.
But inside our hospital, what we can do, that there is like in the local resolution is you can discuss with your educational supervisor. If it doesn't work, so the clinical director, again the medical director, and the college tutor can be involved. Am I clear?
Yes.
Another option is there also, like that is outside hospital. So if you do not feel comfortable to discuss in the hospital, another option is like workplace behavior champion. Have you ever heard of it?
No, no. Can you explain to me more
Yeah.
about them?
So this is, like the consultant and like some other colleagues also, that will be not in your hospital, but the usually the consultant or the senior person from the other hospital, but they know your workplace situation. So they can help. They can, on behalf of you, they can support you. They can discuss with like the higher authority as well as like dean. Even it can be escalated up to the GMC. Okay.
Okay. Mm-hmm.
Okay. Another thing is like what I will also suggest you that you can document everything in in terms of the date and the time and the strictly what is happening, like specific in words, and
Mm-hmm.
it can be escalated also further. That is through the medical director, then again the local the college tutor and the medical education supervisor, the training supervisor can be involved. Okay, and even at the end the deanery, the postgraduate deanery and the head of school education,
Mm-hmm.
and finally the GMC can also be involved.
I see. Okay.
Yeah, so documentation is also important.
Okay.
Okay,
Yes.
anything you would like to to me to inform you?
No, no, that's very relieving that there is a solution for this. Okay.
Yeah, yeah, definitely help is available. I will provide some article also about this odds ratio. And the odds ratio, there is one importance I'd like to tell you, that if the odds ratio is zero, it means that there is no association with the exposure. If it is less than one, that means with the exposure, the risk is reduced. If it is more than one, it is with the exposure, the risk is more. Okay, if
Mm-hmm.
it is more than one. So that is like one importance of it.
Mm-hmm.
Okay, I'll provide you
Yes.
some articles. There are some explanation from the statistics point of view. Okay,
Yes.
thank you.
Thank you.
Okay, thank you. Okay,
Thank you, Dr. Kazi. Very well done, I must say.
thank you.
Very, very nicely performed task. So you assured confidentiality and then I opened up. You have to use that word even in the exam. Even if you will say that everything is going to be safe with me and whatever you're going to tell me will remain with me only. And if you will not use the word confidentiality, the
Yeah.
junior is not going to open up. This is how the role players are instructed. Okay. So even if you will play around the words that I'm not going to tell this to anyone, I will not disclose anything, junior will not open until and unless you will say, I assure you the confidentiality. That word is really important. And the way you explained the odds ratio was really very nice. Well done. From my side, it's going to be a pass station. Communication with colleague, very nice. Okay. I mean, you were empathetic and you took my complaint very seriously. Okay. Patient safety will be like, yes, offering the sick leave also to your junior, because patient safety can compromise because the junior is already disturbed so much. Applied clinical knowledge will be, of course, talking about odds ratio and also how to escalate the complaint. One thing, that first thing is that you will tell the junior that first try to discuss this with your consultant itself, because it might help. Okay, tell your consultant that it is really bothering you too much and it's affecting you very badly. So this might help. So first thing is talking to the consultant. All right, and then if he's afraid to talk to the consultant, then we will tell that then we will involve the other person. Last will be your GMC. And before that, you told your educational supervisor, clinical director, tutor, outside the hospital, workplace, behavior champions, and GMC in the end. All right. So well done. Good one. Very
Thank
good.
you. Thank you so much.
Okay, my dear. All right. So we can discuss the station. So your introduction and rapport building was absolutely fine. All right. So hello, I am Kazi. Hi, Alice. Nice to meet you. How are you doing today? Of course, you will be smiling, and of course, you don't know what's going on in the station. You will not assume that if there is a scenario of odds ratio, it means it is a bullying until and unless you don't gather the informations. Okay. So I understand you have joined the department recently. How's everything in the department and how about your colleagues? Do you feel well supported? So this also comes in your information gathering. Okay. And then, like aim, we know you will say that I understand you are here because you want to know about odds ratio. Am I right? Do you have any idea about the odds ratio? So have you read about it before? This is all also your information gathering if that domain is given there. May I know why do you want to know about odds ratio? All right, so she will say, maybe she will open up in the beginning, or she will just say one line, yes, I want to know about this topic because I find it very difficult. And also, like, I was not able to explain it to my consultant, so I want to know about it so that I can explain it to my consultant in a really very good way. All right, okay. So then your agenda, what you will be doing. All right. So I will be teaching you about the odds ratio and I'll also give the important articles on that. Will that be okay? And by the end of session, you can also give me feedback that how was the session. You can ask about the feedback in the beginning itself that I would like to have. I would love to have feedback from you also about my session. Then yes, you will be asking one more question, very important. Is there any other concern and expectations from today's meeting? So I want to know about the odds ratio today itself because I have to prepare a presentation as well. All right. So we will be discussing about the odds ratio and then you will start teaching that it means the ratio of the events occurring or the events taking place to events not occurring or not taking place. Okay. And then when you will start explaining, you will notice in the face-to-face exam that uh, she is not concentrating. There won't be any eye-to-eye contact at all, and you will find the junior very uncomfortable. Even in online exam, she will be looking down, so she won't be looking at the screen. Then you have to pick up that body language. Well, Alice, I can see that you're not able to concentrate. May I know, is there anything which is bothering you? Are you okay? Is there anything you want to tell me? Like you said that during our this training period, they've like we also have gone through this, and there are many ups and downs. You can of course use your own sentences. So I would like to assure you that this is a safe place, and please feel free to share anything with me. Whatever you will share with me will be absolutely confidential, and I'm not going to disclose anything to anyone without your permission. Then she will open up and you will say everything will be absolutely confidential. Then she will say what's happening in the department. I'm sorry to hear about this. I also appreciate that you have opened up about it. Would you like to share more about it? Maybe I can be of help. So you will be exploring more. All right. So you said your consultant will be angry with you, and why do you think so? She will say everything, and then you have to be empathetic. I'm really sorry to hear about it. No one deserves to be treated like this. Actually, this is bullying, and even any senior does not have the right to treat a junior in this way. It's a totally unacceptable behavior. May I know, since how long has it been going on? Is it affecting your professional and personal life? Do you think any other colleague is also affected by this? So we have to do something about it. Have you tried to speak with the consultant about this issue? She will say no. May I know why not? Because maybe she will say I'm too much afraid. So have you tried to speak with someone else? So please don't be afraid to speak out. We all are here to help and support you, because it can affect you more, and it may affect other colleagues and patients too. And we can try to resolve this issue. The help is available, and there are solutions as well. So what are the solutions? Then talk one by one about the solution. So first of all, I would like to encourage you to talk to your consultant. Speak to him directly and tell him that it's really bothering you and affecting your personal and professional life, because this can also help to resolve any misunderstanding. Am I clear so far? Now, if doesn't help, then talk about talking to other colleagues like educational supervisor or the college tutor or any trusted colleague, and even the clinical director of your department. Or outside our hospital, you may also talk to the workplace behavior champions. Have you heard about them? So in the exam, the role play wanted to know more about them. So who are the workplace behavior champions? He's usually a consultant who doesn't work at your hospital, but they know your training region well, and they will have contact with your educational supervisor and college tutors. They have the appropriate knowledge and training and skills to help resolve these issues. So I can give their contact numbers to you as well. They are very approachable. They will listen to you and help you out, and you can even meet them personally and talk on phone, and they may ask about some evidences like emails or letters from your consultant, and they will also try their best to resolve this issue. Will that be all right? All right. Again, if she's afraid, tell her that don't be afraid. Your confidentiality will be preserved at all the levels, even if your formal complaint is made. And then if issue does not get resolved, then again, it may be escalated to the medical director and the training program director, and even through the PGT. In extreme cases, it can also be escalated to the GMC, the General Medical Council. So we have to involve the GMC in the end. This hierarchy has to be maintained. First, you have to talk with your consultant, then comes your other colleagues, then talk about the workplace behavior champions, medical director, training program director, PG dean, and the GMC in the end. At all times, you will be supported, and we're not going to disclose anything to anyone without your permission. And then, of course, it's affecting her, so you have to acknowledge that. I can see that it's really affecting you, and it's affecting your professional and family life. So I would like to advise you to seek help from your GP, and you can meet your GP, you can talk to him, and you can also meet your educational health advisor. And also we have expert counselors, and you can take some time off from the work. And okay, so already you have told about giving the contact number of workplace behavior champion. All right. And then just ask her, may I know how are you feeling now? All right. So talk about some consequences also, that if this issue will not be resolved, then what can happen? So it is important to resolve the issue. Otherwise, actually, it is unacceptable on moral grounds as well. And if it is not resolved, then it can cause serious problems for an organization and also for an individual like you. There can be lack of concentration. It can affect your professional and family life. In the long run, you will be having low mood, like you already said today, that you're not feeling good, you're feeling very low, and you may not be able to perform your duty well, and this can also compromise the patient's safety. There will be less efficiency, and you will also be having low self-esteem, and this may affect other trainees as well. All right. So let's try to resolve this issue at local level and try to talk to your consultant first. This will help to resolve any misunderstanding, and maybe this will help to resolve the issue right away. Is it okay? And of course, be very supportive. Tell her I'm always here to help you. Whenever you need me, please contact me anytime, and I would be really happy to help you regarding this. How are you feeling now, Alice? So can we continue with the session, or is it okay if I arrange another session on odds ratio? All right, if she says that, okay, you can continue, then you will start talking about odds ratio again, and you will be resuming your teaching and start explaining about the odds ratio. Again, if she is not able to concentrate, then you can say, I can see that you're still not able to concentrate. So let's try to resolve the issue first. After that, when you're comfortable, I will arrange another session with you. And if you wish, I can also arrange your meeting with my consultant as well. And we will try our best to help you resolve this issue. Will that be all right? I will also give you my contact number, and please feel free to contact me anytime. Do you have any question? Any more concerns? No, thank you. So in this way, you will be able to resolve the issue. All right. So there are few things which needs to be covered in the scenario, the important points, which you covered very nicely. Recognition of the workplace bullying. So just by looking at the scenario, even if the scenario is about some statistics, we will not assume that it is workplace bullying. We have to extract the information. And ability to support the victim. All right, make the victim feel well supported. And talking about escalation and reporting procedures, we have to maintain the hierarchy and also maintaining the patient safety and team morale, assuring confidentiality at all times. Now, what are the common pitfalls which you have to avoid in this station? Ignoring the issue or minimizing the victim's feelings that it's okay, like anyway, we are not going to say that it's okay. Of course, it's not okay. It's something very, very serious, right? And jumping to conclusions without gathering enough details. So just don't assume that it's a bullying station. You have to extract informations. And failing to provide clear next steps for escalation. So I always say that hierarchy has to be maintained, okay, one by one. So GMC will always come in the end, all right? And if you're not maintaining confidentiality appropriately, junior is never going to open up and you will lose the station. So this is, you have to take care of these points. All right, so very short session, isn't it? Because only Kazi volunteered. Thank you, Dr. Kazi. Okay, I thought like there were more volunteers who gave the name, but maybe they are not able to attend the session. So that's all for today for this session, and it's a very, very short session. Thank you again. All right.
Thank you so much. Thank you.
Okay. Thank you. Of course, I will try to come up with some more interesting station, some more like important ones. Okay. All right. I hope it was helpful for all of you. Okay.
Okay, then. If possible, labor ward, ma'am.
Labor ward, I will try. Sure.
Okay.
Okay. That's,
Thank you, ma'am.
yes,
Thank you
yes,
so much.
yes. I'll try to do that. Okay. Okay, all of you. Thank you so much for joining, my dears. Thank you. Good night. Bye-bye.